Hey guys, welcome back to my channel, or if you're new then welcome to my channel. Hit that subscribe button and turn on the notification bell, become part of the fam. So I mentioned a few videos ago that I wanted to talk about my experience with medication and the overall medication following surgery. So I'm not medically trained, this is just my personal experience. It's just to give you an insight into what it might be like for you. So I first of all want to talk a little bit about contraception following weight loss surgery. The big thing surrounding contraception and weight loss surgery is that quite often the contraceptive pill doesn't absorb in the same way that it did before surgery. Therefore, this makes it less effective. There are a number of other options available, and that's not to say that the contraceptive pill won't work for you. It's just in the vast majority of cases, that's what's been proven to be the case. Me personally, I have the contraceptive implant in. I had this in before surgery and it was due to be changed about 6 to 8 months after surgery. So I decided to get it changed shortly before surgery just so that I would have that security and that cover of knowing that in the 1 to 2 years following surgery that I wouldn't get pregnant. The reason that I didn't want to get pregnant in the 1 to 2 years after surgery is because that's generally what they advise you to do, is to wait. I also would like to talk a little bit about pain medication following surgery. Immediately after surgery, you will be given liquid paracetamol and liquid Nurofen. Personally, I swapped my liquid paracetamol to children's Calpol as I found that much easier to manage. Following surgery, it's generally advised that you steer clear of medications such as ibuprofen or any medication within that category, which is known as non-steroid anti-inflammatory drugs. That's because they can inflame and irritate your stomach lining, which is already greatly inflamed and irritated following surgery. There are circumstances where they can be taken, such as with a stomach liner, and often advised for a maximum of 3 days. But this is something that you should talk to your care provider about. My other experience with medication following on from surgery is with other prescribed medication. I won't go into specifics on what they were, other than to say that they are antidepressants and antibiotics, both of which I had to take in a reduced dose because I felt the side effects hitting me quite a lot harder than they had previously. I am not entirely sure as to why this happened. I think it's because my stomach absorbed them a lot faster than they had previously. But if possible, I would probably say to speak to your care provider about getting them in a lower dose or even in a slower release if possible. A lot of people who take medication before surgery often find that they're able to reduce their medications over time following surgery. I was advised by my surgeon that if I was on medication such as insulin for diabetes or medication for high blood pressure, that there's a possibility that I might be able to reduce these following surgery. And lastly, I want to talk about medication immediately post-op. As you may be aware, immediately after surgery, you are on a liquid-only diet. This unfortunately also applies to medication as well. I had a conversation with my care provider before surgery to look at options to change my medications over to liquid form. If liquid form is not available, then they often offer the option to have them as dissolvable. Or as I found with one of my medications, that I had to change them to a suitable type in order to get them in liquid form. Sometimes these medication needs to be reduced and monitored by your doctor, so it is worth speaking to them as early as possible in order to begin that process safely. It is worth noting that remaining on liquid medication is not a permanent change, and within a couple of weeks you should be able to go back to tablet form. So I'm going to end that video there, guys. This is just my personal experience with medication following surgery. If you have any other experience or anything you'd like to add, drop it in the comment box down below, and I will see you next time. Bye guys.